what is meant by epidemiology, what are the definition of epidemiology, what are the basic measurements of epidemiology, what is International Epidemiological Association IEA, what are the uses of epidemiology, and different terminology which are used in the epidemiology. Now coming to the types of epidemiology. For study purpose, epidemiology is discussed under two headings. Number one is descriptive epidemiology and second is analytical epidemiology. Descriptive epidemiology means the study of entire population. Study of entire population is called as descriptive. As the word descriptive, essay writing. So when we study the entire population, that is called as descriptive epidemiology. What is studied in this is whole population is counted. That is entire. Each and every member in the staying in the world is counted, or in a to be specific in the given area is counted. Its age, sex, economical condition, marital status, or what is the birth rate, death rate, everything is counted in that given entire population. Why? Because we want to find out the causative agent. Because we want to find out the etiological factor. For what? For estimation, for planning, for the preventive and curative measures. So this is about descriptive epidemiology. Don't go in detail about the descriptive epidemiology. Never the question is asked of descriptive epidemiology. Second type, which is most important, is analytical type of epidemiology. Analytical means analysis. Given data, analyze. So for study purpose, analytical type of epidemiology is classified under two headings. One is case control study. Second is cohort study. As the word indicates, first case control study. Today I will discuss only case control study. Just concentrate. If you understand the case control study, then only you can understand the cohort study. As the case control study, here case means infective person. Disease person means disease agent has entered into the body of the person, that becomes case. Control means normal person. No disease agent has entered into the body. So as the word is case control study, here we study the case in relation or in comparison with the control. Means here we study the infected person in comparison with the normal person. That's why this is called as case control study. Case control, very simple. Case, disease person, control, normal person. We study the disease agent in comparison with the normal person. So case control study. For study purpose, this case control study is also called as retrospective study, because the study which has been, the disease which has been occurred in the past is studied on the basis of the whatever the information we get from the hospital, from the neighbor, from the relatives, from the friend. Means disease has already occurred. So whatever the disease has occurred in the past, retrospective, that is studied in comparison with the normal group of the person or a control group of the person. So for study purpose, this is studied under three headings. Again a formula 3, epidemiology. So case control study. 3 types. This is one of the type of epidemiology study, analytical. Then in this subject of interest is the individual within the population. So this is another case control study. Next, case control study. This is also called as retrospective study because we study the disease which has already occurred in comparison with the normal person. The three things are there in this. Number one is function, this factor or a disease, whether this disease is present or not. This is number one. Factor means a disease, whether that disease is present or not in a given population. Second is case individual with a particular disease. Third is control. Case means infected agent, I told you. Control individual without a particular disease. Again the same thing. Means what? We study the three things in case control study, which is discussed under the analytical epidemiology. What is studied is factor or a disease present or not, case with a particular disease, control without a particular disease. I think this is clear. Next is basic steps in studying this epidemiology are, as I told you, this is discussed under three things. Three heading: factor or a disease present or not, case with a particular disease, control without a particular disease. These three things are discussed under four headings. Number one is selection of case or a control. Means for comparison case disease agent with the control, we must select the cases as well as the control group. Otherwise, we cannot study this. So selection of case or control. For example, this is done. Example is by the diagnostic criteria. For example, breast cancer patient is there. Then we must find out which side of breast is affected, what is the stage of the breast cancer, and what is the prognosis. So, what is stage of the breast? What then the eligibility criteria in this are, which include the whether it is a newly diagnosed or old case. And third is source of the case. So, case any disease agent, disease or a case disease person, we can get the record from the hospital or a relative can give the record. Second is selection of control. So when we are studying the case control study, case has to be controlled. Case has to be compared with the control group. So case disease agent, control normal person. So as we are selecting the case, we have to at the same time we have to control the normal person, that is a control group. Next is the from where we get the sources of control. We get the sources of control from both. First is hospital record, from population, from the neighbors, and from the relatives. Suppose the patient is a child, then relative will give the patient. So all these are reports or sources we get from the past history, back history of past illness, given by the hospital, from the hospital record, or from the neighbor, or from the relative, or from the friend, or from the society or the population. Next is second is when we get this all the record, second step is matching between the case and the control. And third is measurement of exposure. Why we want to all this drama or the show value? Because we are interested in the find out the cause of the disease, etiological factor of the disease, particular disease agent we want to find out, so that we can evaluate, we can plan for preventive and the curative treatment, curative measures for that particular disease. That's why this, after the measurement of exposure, we will analyze this. Now coming to the what are the advantages and the disadvantages of the case control study. Advantages are several. Number one is it is easy to carry out this case control study, because there is no special mission. We are in this, we are studying the case and the control. Infected case, we know, we will study that. Control group, we are finalizing the control group. So it is easy to study. Next is, this is rapid and inexpensive. This study, as a case we know, control group, case group we know, control group we know. So study can be carried out in a rapid and it needs little bit of money. As compared to the study of entire population in distributed group. There we study the whole population. Here we study the case and the control group. Third is, this study is called as bias study. Bias study means already this decision has occurred and everybody knows about this. That's why bias is, this study is called as bias study. This is the institute. Next is, there is no risk to the subject. See, disease agent, disease person, case is here, control is there. So there is no risk for the control from the case. Both are different. Next is, prevention and control programs can be started by studying the case control study. So these are the advantages. Disadvantages, as I told you, it is a bias study. Selection of the appropriate control group is difficult because we get the information from the hospital, relative neighbors and the population from the both sources. And control, we don't get any information because they are the normal person. So finding out the control group is very difficult. So we have to select the persons from the population who are normal persons, not infected. Third, it is the only relative risk can be studied in the case control study. R. Case control study, only we find out the relative risk. Relative risk. Example, breast cancer, what can be the relative risk? We will enter into the next stages, stage 1, stage 2, stage 4, inoperable stage, and patient has got, his lifespan has reduced. So relative risk is there. But if somebody is, some female is suffering from the breast cancer, less likely that other female will get cancer from that patient. Because we are studying the case differently, we are studying the normal control group differently. And next is the, do not differentiate between cause and the association. Cause and the association. For example, breast cancer, cause, it is very difficult to find out. Association, so etiological agent and the association of that CA breast, it is very difficult to find out the relation. Do not differentiate between cause and the association.